Joining us now is Debra Joy Perez, Senior Vice President at Simmons University. So nice to meet you.
Thank you. Nice to meet you as well.
Tell us a little bit about the closing session, if you will. Give us a preview of the themes you'll be talking about.
Well, the closing session is about women and gender equity. And the entire conference, as you know, is based on this theme of equity and achieving equity in health for now and for future generations. So on tomorrow's session, the closing session, will be focused specifically on women. We know that there are a lot of disparities when it comes to issues of health and healthcare among women, and we'll be addressing some of those issues.
Great. What role does the public health community play in addressing systems of inequity that contribute to disparate health outcomes?
There's so many roles that public health can play. First of all, I think it's important for public health to play the role of monitoring and surveillance of these disparities across the spectrum. And specifically, I think the public health role is to look at issues of intersectionality so that we know that even though there are high incidences of HIV, AIDS among women, it's particularly higher for African American women. For example, there are disparities in suicide rates, particularly for certain age groups within the Native American population. So I think the role that public health plays is really to be a surveillance and monitoring role to look at these issues of intersectionality and difference across race, ethnicity, ability, veteran status, all those things that can be considered vulnerable populations.
And finally, to you, why is health equity so important, especially when it comes to women?
Well, I'll just say that it's my life's work, working on equity. I spent 20 years in philanthropy at three of the most important foundations, I think, in the country: Robert Wood Johnson Foundation, Annie E. Casey Foundation, and the Gordon Betty Moore Foundation. And in each of these roles, I've been able to work in a space of identifying and highlighting ways in which women and other underrepresented minorities are not present, are not considered, and not centered. So for me, it's been kind of a life's journey to really focus on equity, because I believe fundamentally that when we focus on equity, everyone's health is improved, everyone's life is better, and equity is really about excellence.
Thank you so much, Debra. Appreciate your time.
Thank you.
APHA TV has more exclusive content you can check out by clicking on the links to the right. Be sure to check back each day for brand new interviews, stories, and more from the conference. You can revisit past years of APHA TV by visiting our channel.